Hello everyone, myself Shreya, studying at Shri Medical College, Hospital and Research Institute. I am mentored by Dr. Rohini ma'am. Today we are going to be talking about cervical vertebrae. There are 7 cervical vertebrae in which 3 to 6 are typical, 1, 2 and 7 are atypical. The cervical vertebrae is mainly identified by the presence of foramina transverse area. So first we are going to be talking about typical cervical vertebrae. This is the body of the typical cervical vertebrae. This is the foramina transverse area that transmit vertebral arteries and veins. There are 2 tubercles, anterior tubercle and posterior tubercle. There are 2 articular facets, superior articular facets and inferior articular facets. There is the presence of bifid spine on the posterior side of the vertebra. This is the main feature of typical cervical vertebrae. Next, we are moving on to atypical cervical vertebrae. First, this is the first cervical vertebrae. It is also called atlas. It is ring-shaped. The superior articular facets of first cervical vertebrae is bean-shaped. That is how you identify the first cervical vertebrae. There are 2 arches, short anterior arch and long posterior arch. Anterior arch is mainly identified by the presence of median anterior tubercle. The posterior arch is identified by median posterior tubercle. There is the presence of oval-shaped facet in the posterior side of anterior arch, which articulates with the second cervical vertebra. Next, we are moving on to second cervical vertebrae. It is also called axis. It is mainly identified by the presence of dens or odontoid process, which articulates with the first cervical vertebra and which promotes head's rotation. I will show you how it articulates. This is how it articulates. Next, we are moving on to 7th cervical vertebra. It is also called vertebra prominence. It is because of the long spinous process, which can be palpable at the base of the neck. It has small foramina transverse area, so it does not transmit any vertebral artery or veins. Thank you.